So in this lecture, we will cover Chapter 14, Streptococcal infections. Now with this lecture, we're just going to touch on the disease process that these infections cause and not necessarily the identification of these organisms. We will touch on that once we discuss them within microbiology. Now these first couple of slides do contain some various terms that you should be familiar with. So just be sure that you review them and make sure that you are aware of what they mean. So most of your streptococci that actually have the cell wall antigen that we'll type for Lancefield group A are known as your Streptococcus pyogenes. Now we will talk a little bit more about that Lancefield grouping and the various streptococci and the different organisms that are within this family once we are in micro class. And so you'll understand a little bit more about what the various things I'm discussing mean, but for now we're mostly going to focus on that disease process. So with your strep pyogenes, it is the most common causative agent of the pharyngitis. So this is what we refer to as strep throat. And it can cause other disorders, more specifically things that you may have heard are things like scarlet fever and impetigo. The most common type of bacteria that actually causes the necrotizing fasciitis, where you actually have the death of the various tissues. So if you have some sort of skin or deep tissue infection, it does cause the necrotizing fasciitis that will destroy the tissue of the skin and the various layers of the skin all the way down through the muscle, and sometimes it can even go into the bone. Now, most of the time, when someone has a strep pyogenes infection within the throat, strep throat, we typically think of it as something being fairly easy to treat. You give the patient an antibiotic, and they usually, do well with it. However, if a strep pyogenes infection is left untreated, there are various complications that can actually develop from it, to include things like acute rheumatic fever, post-streptococcal glomerulonephritis, as well as some other things that it can kind of disseminate out and cause things like sinusitis, ear infections, septic arthritis, neonatal septicemia, rare cases of pneumonia. So really making sure that you get an early diagnosis when someone has strep throat is going to help to prevent any of these other complications for developing. And so that's, again, one of the reasons why it's very important that when you diagnose and treat an infection, that you do take all of those antibiotics just to prevent that organism from continuing to grow and spread throughout the body. It's also important to make sure that you take the proper antibiotic and dosage. Now, one important thing to note about the actual Streptococcus pyogenes organism itself is kind of pretty much to understand that outside membrane of that particular organism does have some things on that cell wall surface. So just like kind of how those antigens kind of poke through, the bacteria itself has a similar process where it's got various components on that cell wall surface that allow that organism to actually adhere to the human epithelium and will actually initiate that infectious process. Now, one of those that we refer to as an M antigen or an M protein. Now, the M protein is a cell protein that is found in association with the hyaluronic capsule, and it actually is a major virulence factor for strep pyogenes. So some of the strands of strep pyogenes actually lack that M protein, so they can actually cause an infection. But there are some forms of it that do actually have that M protein, so you will see that infection actually take place. Now, the M protein, what it will actually do is inhibit phagocytosis, and antibody synthesized, any antibody that is actually synthesized against that M protein will actually provide a type-specific immunity to group A streptococci. So basically that M protein is what's going to kind of stimulate that immunity type of response to that organism. So if it lacks it, it's not going to cause the infection, but if that M protein is there, then you will have that infectious process that's going to take place. Now, once the infection does take place, you have a group of extracellular products that will actually help with that pathogenesis as well as the diagnosis of that disease. But those antibodies are actually produced in response to the substances that substances on the outside of that cellular wall, or that make up that cellular wall. And so these substances will actually provide that evidence that you have that streptococcal infection that's going on. Now, there are two homolysins that are to be noted that will actually have the ability to damage the human and animal erythrocytes, as well as the some of the leukocytes and the platelets that's actually produced by this particular organism. And so we're going to talk about those in a little bit as well. Now, morphologically, once we actually get into micro, all of this will make a whole lot more sense. We did kind of touch on this in intro. Strep pyogenes is a gram-positive cocci. They do present in chains. So you can see an image there of that gram stain where you have those chains of those cocci that are linked together. They are divided into the Landsfield group type A. Now, the Landsfield grouping we will discuss in microbiology, and that's just basically a kit test where you're looking to see which of those little antigen type markers on the surface of those cells are present. But again, we'll discuss that later. But for now, they do type Landsfield group A. Now, if you've ever noticed, worked in the lab or any kind of physician's office anywhere, or ever had a strep test done, you may notice on those kits that it actually says strep A. We have the two kits here. These are pretty common. If you've worked in the lab, you may have seen these at some point. And what it's actually looking for is that Landsfield group A, which is your strep pyogenes. And in addition, these organisms do have that ability to cause beta hemolysis on the blood agar. So we kind of talked about in that previous slide how these organisms have those hemolysins in them. And so as you can see on this blood agar plate here in this image, get my writing tool here. So here you see in this image where the organism is grown on this blood agar plate. So typically you have that red color of that plate, and now that organism where it's growing actually has that clearing around it. So you can see where it's actually destroyed those red cells that are in that agar plate, and so you have this little zone of hemolysis where you have a complete clearing of that hemoglobin. Now, on the surface wall of that organism itself, so you remember if it's a cocci, it's just like a little ball, little circle. On that surface, these organisms have structures that are called fimbriae. And so they will actually arise near the plasma membrane, and they will project through that cell wall and capsule. And so what will happen here is that you have those MNR antigens again. And so when we talk about those, and we'll see another slide here, we'll kind of explain that a little bit better, that M1 is the one that's going to kind of help to stick that organism to the surface of the human epithelial cell. So here, to kind of give you a visual of what we've been talking about, you have a single cell strep pyogenes organism. Of course, it's like I said, it's a cocci, so it's a circle or a ball, and then you have that cytoplasmic membrane, just that outside layer of that organism or that cell, and then you actually have a capsule around it. And so within that capsule you have all of these different things that are going to help with this organism in its ability to infect the host. And again, kind of pointing out that M protein right here, where that kind of helps with that adhesion and attachment to the host cells. Then within that cell, it will actually produce various enzymes, and these enzymes give that infectious component of the hemolysis and various things like that. So basically, the cell structure itself is its virulence. The cell structure and makeup, its ability to produce these enzymes is what aids it in causing the infection as well as survival and destruction. All right, so now let's go back to those extracellular products that are produced by this organism. Now the first one we're going to talk about is streptolysin O. So streptolysin O is an oxygen-labeled enzyme that will bind to the red blood cell membrane, and then what it will do is actually cause this rearrangement that takes place within that membrane that will actually in the end create holes, and then that allows that hemoglobin to seep out of those cells. And then what will actually happen, streptolysin O is antigenic, meaning that it will produce an antibody response within the patient, and then we actually look for that antibody response through those serological test methods. Now the next one we're going to talk about, streptolysin S. So that one is oxygen stable. It is an oxygen stable enzyme that is responsible for that beta hemolysis on that blood agar plate. So where we saw that clearing around where that organism was growing. Now, what streptolysin S does is it will actually disrupt the permeability of that red blood cell membrane, which will actually cause osmotic lysis. Now, streptolysin S is not antigenic. The other substances that are produced by the group A strep or Streptococcus pyogenes will actually facilitate the spread of the organism through the subcutaneous or deep soft tissue. And so those we have here, where you have the hyaluronidase, which breaks down the hyaluronic acid that you find in the host connective tissue. So that's where you kind of start getting that breakdown of the actual layers of the skin and getting real deep down into those tissues. You also have the DNase, and so there are different forms of it, but what the DNase actually does is it will actually degrade the DNA within the host. Next we have streptokinase. Streptokinase is an enzyme that actually dissolves clots by converting the plasminogen to plasmin. And then you have also have a couple of other extracellular products that will elicit an antibody response, like the NADase, the proteinase, esterase, and amylase. So those will all create some sort of antibody response once that organism is present within the body. And then the last one is your erythrogenic toxin. And so what this will do is it is elaborated by scarlet fever associated strands, and it is actually responsible for that characteristic rash that you will see with these types of infections when you actually have an infection that results in scarlet fever. And just to kind of briefly cap the epidemiology, it is seen mostly in children, school-age children. It is spread through contact of large droplets from the upper respiratory tract. So just, you know, just children being children, your hands in your mouth, your pencils in your mouth, using the same things, drinking after each other. You know, high school, middle school students tend to, once one of them gets it, they all start kind of getting it. So basically it can be spread very easily. You know, usually if it's, once you get it in your household, you're doing everything that you can, like changing out toothbrushes and not drinking after each other, just to kind of avoid transmitting that infection from one person to the next within your household. Now, there are several things and complications that can come from it. We're going to talk about those a little bit more, things like rheumatic fever, issues with the heart. So basically, if you've got that infection that just kind of doesn't get treated and continues to spread, then you're going to start seeing other complications. And so obviously those complications are going to arise from the fact that you have all of these extracellular products that are going out within your host and causing this destruction to take place. So your strep pyogenes infections, they do have a wide variety of signs and symptoms that happen, and that's because they cause a wide variety of infections. And the most common one that we are aware of are the strep throat that are, causes an acute pharyngitis, as well as, upper respiratory tract types of infections. Now, you can also have other things where, again, we kind of mentioned when it starts to affect the skin, things like impetigo. It can also infect the sinus cavities, kind of spread out from there, causing things like pneumonia. Other complications that we see are things like scarlet fever, as well as rheumatic fever affecting various organs throughout the body, actually making its way to the kidneys and causing problems within the kidneys itself. So with those upper respiratory tract infections, it's going to be kind of presenting what typical upper respiratory infections have, where you have that inflammation in the sinuses, nasal passes, coughing, fever, vomiting, unable to eat, just an overall feeling of not feeling well. You also, with your strep throat that you get, within children, you're going to have that sore throat, that fever. A child's fine, and then all of a sudden something's not right. It just kind of has that rapid progression. You'll start seeing it on the tonsils. You might see those little specks within the back of the throat, those swollen tonsils. Sometimes you can actually get little white patches on the back of the throat. So it just depends on the individual patient, the particular strand, as well as how it's going to present. But kind of once you realize what's going on when the child comes to you with the strep throat and you open up and you start seeing those red specks, it's a pretty good indicator that that's probably what is happening. Let's see. So with impetigo, you get these little lesions that will form on the skin that will be kind of red, tender, swollen. They can kind of progress onto where you get that scab-like appearance. And so you can see there this image where you have that irritation on this child here. It looks like a child where you've got all of this scabby, crusty looking infection that's going on around this child's nose here. With the cellulitis, you can see here where the infection has reached this individual's foot, and so you've got all that redness and swelling from that cellulitis, from that infection. Here in this bottom one, once it kind of rolls over to that rheumatic fever, you start seeing that classic rash. So you see the rash on this individual here, looks like on their back, and then this child here, you can see that rash on the face. Now, this can be confusing because this rash does look very familiar with another organism that causes something called slap cheek disease. And of course, there's an organism that causes that, and you'll learn more about this later, but you can see all of this redness that's taking place on these cheeks. So you would definitely need to go through the test process to make sure that you rule in strep throat and treat it. And of course, if you got a negative on this child, I would want to confirm with an actual culture or something else on that rapid strep, because you don't want to not treat a strep infection and then it roll over and damage the heart or the kidneys. And I have seen this happen in children before, so it's not something that you want to play around with. Now again, if some of these conditions go left untreated, just the toxins alone that are produced from it can be very fatal. So again, you've got the spread of the infection to go to other sites to cause destruction, as well as producing those toxins. So making sure that you properly diagnose that strep infection very early on is very, very, very important. All right, so for diagnosing, so traditional cultures, throat cultures is traditional as far as in the past what we've done, and a lot of physicians will still kind of go back to this method, just because it can be so finicky trying to detect them on any kind of rapid kit. If you don't have enough of that organism actually on that swab when you do that kit, you can get a false negative. If the child is fighting, or the patient come in and they just ate a big breakfast and they had something to drink and they noticed that their throat was hurting while they were drinking their morning coffee. Well, they've washed all of those, those fresh organisms that are on that epithelial that have built up and grew during the night. They've washed them away. So the sample itself just may not get enough organism on that swab to actually be able to be detectable. So there are a lot of factors that can cause those false negatives. So what a lot of places will do is when they're collecting that rapid strep, they'll get 2 swabs. One goes for the rapid strep test, the other gets sent for culture. And so they're looking on that culture to look for the presence of this organism and do further testing. In addition, if there's something else that's causing that infection in the throat, then you can grow that. That's not going to be detected on that group A strep kit. There are some direct molecular methods that are out there now that's actually going to use the DNA probes to detect it. So these are going to be similar to like your flu test and things like that that you might do by those molecular test methods. Looking for those toxins. So we did talk about those various toxins and those extracellular products that are produced. And so looking for those in some of these various test kits or an example of how we use these to actually do some of that testing. So really, truly, there are so many ways out there now to kind of detect strep. There's really no reason why some of these things, the progression of these things should be the way they are, other than patients and physicians not recognizing signs and symptoms and getting them treated, or not properly finishing antibiotics, or not recognizing when you have individuals that are carriers and things like that. So these are all things that we'll kind of talk about a little bit more once we reach micro, but for now you're kind of seeing and understanding the disease process of just this one particular organism. So it kind of helps you understand the importance of the lab in actually having some early diagnosis. That early diagnosis is going to be key to treatment and key to prevention of some of these complications that come with it. Streptococcal toxic shock syndrome. So most of you have probably already heard about this at some point in your life, and depending on your age, you might remember a time frame there where the tampon boxes came with this insert that was just loaded with information on toxic shock syndrome. So let's talk a little bit about that and what it is to hopefully give you a little bit better understanding of what it actually does and how this process takes place. So once you actually have the streptococcus that has entered into the patient, again, we've kind of heard over the years the use of tampons to actually introduce the strep infection to the patient. So once that strep infection is actually introduced, then what's going to happen is you're going to have it kind of invade. And then from there, it's just going to kind of spread out. So it's going to invade somewhere through some sort of injured skin. A cut, a scrape, surgical wound, something, there's somewhere, something's happened that it gets introduced through the skin. So through some sort of injury. Then from there, what's going to happen is it's going to actually start producing these pyogenic exotoxins that will cause a fever within the host, and then from there it actually helps to start to induce shock by lowering the threshold of those exogenous endotoxins. So those streptococcal pyogenic exotoxins A and B will actually be introduced to a human mononuclear cell to synthesize not only the tumor necrosis factor but also the interleukin 1 beta and interleukin 6. So this is suggesting that the tissue necrosis factor could actually mediate the fever, the shock, the tissue injury that we actually see in this patient population. Now, M protein contributes to the invasiveness. This is due to its ability to actually impede that phagocytosis of the streptococci. So it's kind of what's blocking it from actually being destroyed. Then you have these other things called superantigens that will actually bind to the alpha and beta T cell receptors and the major histability complex class 2 molecules. And then they will actually start to activate a percentage of those T cells, and then it'll start creating the level of those cytotoxins. So you can see how this process just keeps building and building and building, and then you start reaching a point where it's actually going to produce some of those shock-like symptoms. Now, the symptoms of the toxic shock syndrome can include things like the shock, fever, rash, redness and swelling of the area that's infected. So you're basically looking for those signs of infection, that inflammatory process that's taking place. The average incubation period for that organism is actually about 2 to 3 days before you kind of start seeing, or 2 to 3 days after that actual minor trauma, before that organism actually starts kind of reaching the point that it's starting to produce these symptoms. So, you know, recognizing those symptoms very early on is important in order to prevent all of those exotoxins and things from, you know, creating all of these symptoms that, you know, are basically going to put this patient in a predicament where they could ultimately die. So you've really got to kind of, the physicians or the clinicians have to be able to recognize these things to catch it very early on, because it can go downhill very quick. So using those various serological tests to kind of confirm that the patient does actually have that group A strep infection is going to help them when they can help the clinician when they can actually see that there are rises in those things like the streptolysin O and the DNase B, because that means that that's an active infection that's continuing to produce these things. So you see in that level go up, 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 and up, then you know that, hey, this infection is really active and this patient is about to be really, really, really sick. So you're definitely looking for all of that to take place. Now, there are some patients in which there's some renal involvement that is indicated because you have the presence of that hemoglobin in the urine, as well as you've got those serum creatinine values that are starting to increase. So you know that the kidneys are having problems. And so looking for other lab tests to kind of help aid in that diagnosis is what you're going to need. So again, just because you work in one department, that does not mean that one little thing that you might report out does not aid in the diagnosis of a condition that another department might be working on. So just because the patient is getting a culture in micro doesn't mean that your creatinine values are not as valid as diagnosing that culture and figuring out what organism it is, because those creatinine values are going to indicate that, hey, this infection is systemic and it's affecting organs now. Now, if a patient reaches the toxic shock syndrome state, then you know, intervention, immediate treatment is crucial. So making sure those patients stay hydrated with IV fluids, giving them medications to maintain blood pressure, you know, just monitoring those symptoms, looking for progression, treating those patients with penicillin and beta-lactam antibiotics, which we'll learn a little bit more about that once we reach micro. You know, that's going to help to keep that bacteria from continuing to grow and spread, which is going to lessen those toxins that are being produced around the clock from more and more organisms that are replicating and just growing in number. After recovery, once you've kind of started treating that infection, you can start seeing issues with the skin, and so sometimes the surgery may be needed to actually clear away some of that dead stuff, that dead skin, and work on that wound healing from that point on. So one other organism that I do want to mention within this unit is the Streptococcus agalacti. So this is group B. So Pyogenes was group A in that Landsfield grouping. This is a group B organism. And so these infections can actually cause a substantial morbidity and mortality within adults and neonates. So actually about 30% of women can carry this organism asymptomatically in their genitourinary tract. With this particular organism, it does have a fatality rate of about 26 to 70% among men and non-pregnant women that actually have the group B strep disease. And despite lots of measures that have been put into place to actually try to prevent this infection, it does still remain the leading cause of early onset neonatal sepsis within the United States. So one of those early measures is to actually do a screening of the pregnant mothers around 35 to 37 weeks of gestation. And so what we're looking for is to actually see if the mother has the group B strep colonization, and so the clinician will actually take a culture about that time to see if that group B strep is growing. So you may, if you already work in a lab, you may have already seen this, or if you've ever had a baby, you might remember, maybe not, them doing a culture swab of the vaginal area, just to check and see if that group B strep is present within that female patient. Now, if those cultures do come back positive for group B strep, then that mom will go through an antibiotic prophylaxis once she's there for delivery to hopefully kind of reduce the possibility of that group B strep being presented to that newborn during that birthing process. So again, this being a strep, it is a gram-positive cocci, and strep do usually form chains. It causes invasive disease primarily in infants, pregnant or postpartum women, older adults, with the highest incidence being the young infants. And that's just due to that exposure from the maternal aspects. So typically, if you think you're dealing with group B infection, most commonly, as far as, if a patient is septic from it, you're going to recover it from the blood, sometimes spinal fluids. Using serological identification like latex agglutination for group B, antisera is also available. Doing those cultures, molecular methods, there are a lot of molecular methods that are out there now. Rapid techniques for finding that group B strep by using an enrichment broth and then subculturing it to look for those organisms, including DNA probes, nucleic acid test amplification, PCR testing. So there are a lot of things out there to kind of, again, try to detect this particular organism very early on to hopefully prevent it from being passed to the infant. But occasionally you do still have cases where that doesn't work, or maybe the mother didn't get prenatal care, and so she comes in and delivers without that prenatal care, and that infant is still exposed. But we do try to do everything that we can to kind of prevent it very early on.